Good afternoon all. And this study is about etiology and association of pediatric cataract and visual outcome following cataract surgery. Objective of study is to study the various etiologies and associations seen in pediatric cataract and the visual outcome following pediatric cataract surgery. This is a retrospective observational study, and the study population include the hospital records of the patient who underwent cataract surgery at Compressed Eye Hospital, Calicut before 10 years of age, and the study duration is 18 months. In this study, we took 88 eyes of 60 children with cataract who underwent cataract surgery before 10 years of age. A detailed history of antenatal, perinatal, and postnatal period was taken. Relevant laboratory investigation, including torch and tests to rule out any metabolic diseases, were done. We excluded traumatic posterior segment pathologies. The patients underwent cataract surgery with or without IOL, depending on the axial length and age at surgery. And immediate postoperative amblyopia therapy was initiated along with postoperative medications. Visual acuity was assessed periodically according to the age and performance of the patient and was presented in Snellen acuity notation. The visual acuity outcomes were analyzed at the end of three years post-operative period. Coming to the result, in our study, there were 58.3% cases of unilateral and 41.7% cases of bilateral cataract. There are different studies having different laterality distribution. Coming to the etiology of pediatric cataract in our study, around 54.5% of cases were congenital and developmental, and torch infections were identified in 22.7% of patients, with half of these patients for both CMV and rubella infections. Additionally, a 7.1% of cases developed following radiation or chemotherapy for malignancy. In our case series, most of the cases were post-medulloblastoma cases. The infection, 50% of cases were positive for both CMV and rubella, and 40% were positive for rubella itself. Final visual outcome at the end of 3 years period, 39.7% of patient was having a good visual acuity of more than or equal to 612. Around 9% was having less than 660 visual. Etiology-wise visual outcome, we got a good visual outcome in post-malignant treatment cases and a worse visual outcome of less than 660 in infectious cases. Coming to the discussion, outcome of pediatric cataract surgery depend on multiple factors like age at presentation, age at surgery, type of cataract, associated ocular conditions, and associated intra or post-operative complications. Early detection and prompt referral are key to successful management and surgical decision. Majority of cases presented late to hospital, and this late presentation negatively affect the binocular vision development and dense amblyopia. Late presentation to hospital may be due to limited medical access or low parental awareness. In our study, 4 cases were presented as exotropia, later found to have cataract. Dense amblyopia was developed, which was managed with occlusion therapy, with compliance significantly affecting visual outcome. In our case, almost half of the pediatric cataract cases, we couldn't find any specific cause. Most cases, around 31.4%, were aged between 4 to 6 years. The proportion of cataracts was higher in males than females. There are previous studies shows some congenital cataracts are due to X-linked mutations. In our study, 48.7% of eye failed to achieve vision better than 612. It's possibly due to delayed surgery leading to amblyopia and other post-operative complications. Etiology-wise, post-operative worst outcome is noted in infectious cases. Among the infectious etiology, 40% were rubella positive and 50% were both rubella and CMV. This emphasized the importance of MR vaccination. Post-operative complication noted in our study are hydrocyclitis, glaucoma, and secondary membrane formation. Hydrocyclitis, around 7.9%, was the most frequent early post-operative complication we found, followed by secondary glaucoma, 4.5%. Patient with hydrocyclitis achieved good visual outcome with vision better than 6-12. In contrast, cases of secondary glaucoma showed poorer visual outcome with vision typically worse than 624. In conclusion, pediatric cataract remain a major cause of preventable childhood blindness, with congenital and traumatic etiologies being most common. Early detection, timely surgery, and appropriate post-operative care are essential for optimal visual outcome. Delayed presentation, poor compliance with amblyopia therapy, and inadequate follow-up adversely affect visual outcome. Enhancing parental awareness, improving access to pediatric eye care, and establishing effective referral pathways are essential for better management. Thank you.
Very nicely presented, Dr. Lima. There are two questions. Was the IOL power calculation done with some amount of under 10% under correction or 20% depending on the age? Number two, was cataract surgery associated with posterior capsular excess in age less than 6 years? Did that make any difference in the outcome of the patient, visual outcome? Because what I see was that in about 80% the visual acuity was better than 6 by 60. Less than 6 by 12 it was 40%, and between 6 by 12 to 6 by 60 another 40%. So 80% had reasonably good visual recovery. Was it dependent on the age of the patient? Was it dependent on any other factors? Like you have classified infective, this was the result; in congenital, this was the result; in traumatic, this was the result. Was it dependent also on the age of the patient? What was the smallest stage and what was the highest stage which was taken? And highest stage was 6 years, up to 10 years. Say. And so the best results were between 4 to 6 years, you said. Okay.
Number of patients that you saw was between 4, not the best visual outcome. You didn't want to divide according to the kind of surgery you did, whether how you rehabilitated, whether you put an IOL. You didn't want to divide along all of those lines because you sort of pressed it as descriptive analysis, right? You had a fair number of patients.
Yeah, it also depends on whether it was unilateral, bilateral.
Yes.
A lot of other factors are also there, confounding factors. That also should have been.
Thank you.